Hi everyone, Dr. Suneel, Dhand, medical doctor. Welcome to another video. There is an absolutely enormous problem which afflicts thousands of people each and every day in hospitals up and down the country. And this problem will literally take somebody who was previously fully independent, functional, enjoying life, to being in a nursing home in no time. And I feel so very strongly about this because I see this play out every time I'm in the hospital, and it happens everywhere. It's not necessarily the fault of the hospital, although I do think healthcare could do a lot better. And I talk about a lot of issues like this in my regular free newsletter. Link is down below for those of you who aren't already signed up. And I would hate for this problem to happen to you or a loved one. It's absolutely tragic. What am I talking about? I'm talking about sinking in bed syndrome. This is what I call this problem. And I've talked about this problem many times before, but I'm going to keep talking about it because it is so very terrible and also very preventable as well. What is sinking in bed syndrome? That will take somebody who was previously functional, driving, walking around, enjoying time with their family, usually somebody in their 70s, 80s, or 90s, to being in a nursing home in no time. So let's take a typical scenario here. Somebody in that particular demographic picks up an illness. So let's say for argument's sake, it's a lung infection, a pneumonia, and they end up in the hospital and it's quite a severe illness. They need a few days of antibiotics. They may need fluids. Perhaps they had sepsis when they first came in. So they were very sick, and it could happen to anybody, even somebody who's supposed to be in good health. These things can happen. And the scenario is that after 3 or 4 days, they'll be getting better. Their parameters will be getting better. They'll be feeling a little bit better as well. But the big problem is they barely moved that whole time they've been in the hospital. So remember this. This is someone who is fully functional and they've been in bed for a few days. And even if somebody was in their 20s or 30s. I mean, you put anybody in bed for a few days and they're going to feel weak afterwards. They're going to feel terrible. But the problem is, above a certain age, when this happens, there is a phenomenon which causes even more significant weakness. And I'm going to write it down here on my whiteboard. Pardon the doctor's handwriting. So it is called deconditioning. The muscles get very deconditioned and weak because they haven't been used. So then what happens is somebody will get up and they'll be weak and their family will voice concerns about them. Perhaps they're not quite strong enough to go home. And then they'll end up in a rehab facility. And it's not uncommon when this happens for somebody to sadly get stuck in a cycle. There might be another complication. And before you know it, this person who's usually in their mid-late 70s, 80s, or 90s ends up somebody who can no longer live at home. And I really believe that the primary issue here was that they were immobile. Yes, of course, I accept the fact that they were sick in this example with a pneumonia. Of course, it was a sickness that initially started this cascade. But sinking in bed syndrome, as I call it, sunk in, no pun intended. That's actually a good pun. Yes, it's sunk in. And what are the reasons for this? Why does this happen? Well, it's complicated. I don't think that anybody who's in medicine wants to be in medicine to make people sicker. Hospitals, I would hope the philosophy is to get people better, but hospitals are very busy. Healthcare, there's a lot going on. There's all these protocols now, don't get me going. But regardless of which, people frequently at the beginning of their hospitalizations are not moving as much as they should. They barely get out of bed. I think most hospitals chronically underinvest in mobility aids, in physical therapists. I mean, a physical therapist might get somebody up for 20 minutes or so and walk with them. Nurses are super busy and stretched and they don't have time to get people up and walk. And this fully functional person has got really deconditioned. And then they recover from their illness and lo and behold, they can't go home. They're simply not strong because after all, it was quite a severe illness. But I think that this could have been nipped in the bud. And this is the purpose of this video because it's horrible when I see this. I really feel for the patient and their family. And I think that this could have been prevented. Now, actually, what I do as a doctor, I will write in capital letters, even on the computer in the orders section, patient must get out of bed as soon as they're able to for every meal. and must encourage ambulation within the room. That is a must. And often I will write, if this can't be done, I want you to page me back because I want to look into why it's not happening. And again, I don't want to put so much blame on staff members who are so overstretched and hospital staff are not receiving the right investment, etc. But as soon as somebody is starting to get better, it is imperative, if they were fully functional before, that they get moving, because even, I really mean this, even just 48 to 72 hours of not doing this when you're already sick is going to set people back, and it leads to this cascade where they end up in no time unable to go home. It's a horrible situation. Something may have happened at the rehab, they got another complication, etc. And maybe you all have stories of loved ones who this has happened to. Feel free to comment down below. But yes, it all started with the illness, but I really firmly believe that had this been jumped all over from the beginning, it could have been prevented as soon as somebody's getting better. Obviously, if somebody's sick, they can't get up. So the bottom line is here, what can you do to prevent this happening to yourself? Well, it may not be for yourself. If you're sick, you may not be the best advocate, but for a loved one, whether it's your spouse, whether it's your parent, your brother, sister, whoever it is. So I have a few notes here on what you should do, because often, and I feel so bad, often family members will speak to me and they'll say, Dr. Dan, please, can we get our relatives up? They've been in bed, they're getting weak. And I'll look at the chart and maybe I've just come on the case and I'm thinking, oh my goodness, 4 or 5 days, they barely moved. This is awful. And you shouldn't have to beg the staff to get your loved one up. It's horrible, and it happens every single day in America. So, okay, I want you to do this. Number one, recognize this as a problem. So have it in your head. Remember this video for the future, okay? Because chances are it may well happen because it happens so much. So recognize early on, if you have a loved one who goes to hospital for any reason, if they're not moving around enough, and it could even be a more minor thing, maybe there's a fall and there's no broken bones, but perhaps they end up just lying in bed longer than they should, then recognize this problem. And I want you to get on the backs of the staff, obviously politely, but I want you to tell the staff that this is a priority, okay? Please get my loved one up, and I want them to have physical therapy. And if there's mobility aids, I want them to be walking, okay? First thing I would like you to do. Number two, if and when this doesn't happen, because sadly, sometimes it doesn't happen. I've seen this many times throughout my career. I want you to please keep on asking, saying, my relative, tell the doctor, my relative needs to get out of bed, because a lot of doctors don't even realize that this is a core part of recovery. As soon as somebody is getting better, if they're in a certain demographic, they must start get moving right away. Otherwise, they lose their function forever. It's terrible. Okay, so keep on asking. And number three, this is actually the last thing that you may have to do, is simply do it yourself. Seriously, just get your loved one up into the chair, make sure they're in the chair for meals, and walk them yourself if they're ready to be walked. Hopefully the medical staff will be okay with you doing that. They should be, because this problem, sinking in bed syndrome and deconditioning, is simply too important. And that's why I keep talking about it, because it hurts me as a doctor who wants people to be well when I see so many people going through this process. I mean, when I think about it, it's usually somebody in their late 70s, 80s who this happens to. And I know in the back of my head that, oh, you're not going to do so well at rehab and you may never be home again, and you were very functional. Now, am I saying this happens to everybody who goes to hospital? No, but it happens to enough people. And hospitals, healthcare environments are places where you want to be for the shortest amount of time possible. I cannot stress that enough. You will be surrounded by bugs. You will not be able to sleep well. The food is absolutely terrible. The job of a hospital, as far as I'm concerned, is to get somebody better. This is why I do what I do, acute hospital medicine, get you better, give you some great advice, say goodbye, follow up with your primary care doctor. And it is to be a stay which is as short as possible. And during that stay, you should not be getting weaker. But yes, hospitals can do some amazing things. There's some amazing medications which can rapidly reverse a condition. I mean, antibiotics come to mind. And it's funny, I often talk about the negatives of healthcare, which there are many, but I, of course, am fair about this. There are many positive things. I see people every week who literally are at death's door with sepsis, pneumonia. They're not even able to speak. And a few hours of IV antibiotics and fluids, and they're up, they're talking, and they're on the mend. And it's great. But once you're on the mend, this is why I come in. Maybe some nurses or hospital staff don't like it. I'm so strict about this. Hospital day 2, as soon as that trajectory is right, if you were functional before, you're going to be up into the chair 3 times a day. I want you to move. I tell my patients, move your arms and legs. Do not get deconditioned, because after a certain age, this affects you greatly and you may well never bounce back. So please remember that. I hope this video was helpful. Avoid at all costs sinking in bed syndrome. And maybe there is a severe illness where you can't get up. That's fair enough. I'm not saying this applies to everybody, but it applies to enough people for me to keep on hammering home this point, because I want you as well as possible. And I want you to be able to ideally stay away from hospitals. But if and when that day comes that you or a loved one needs to be in hospital, then you have to remember these things and remember that you are your own best advocate. And also, having a loved one by your side, an advocate, can literally be the difference between life and death. A loved one who is noticing what isn't quite right, what isn't happening, can really make all the difference, no matter how good the doctor or the nurse is. All right, everyone. Thank you for watching. I do appreciate you watching my videos. I hope that was helpful. Leave a comment down below, especially if you've had something like this happen to you or a loved one. And also check the links in the description down below for my website, all the other work I do, our natural supplement store, ohighwellness.com. If you're in the USA, North America, ohighwellness.co if you're in the UK or Europe. If you liked this video, do hit the like button, share with anyone else who may benefit. And if you enjoyed this video, you will also enjoy some of my other videos on health and wellness. Take care, everyone. Have an amazing weekend, and we will speak again very soon.